As far as the outbreak in the Sun Belt, I said yesterday we continue to vigorously combat the rise of cases in the South and Southwest and the West. We're closely monitoring and aggressively acting to control the infection in Texas, Arizona, California, Florida. Arizona is starting to come down. Done a very good job. They're all doing a good job. They're very talented people. There are likely a number of causes for the spike in infections. Cases started to rise among young Americans shortly after demonstrations, which you know very well about, which presumably triggered a broader relaxation of mitigation efforts nationwide, and a substantial increase in travel also was a cause. Increased gathering on holidays such as Memorial Day, as well as young people closely congregating at bars and probably other places, maybe beaches, 4 or 5 different listed places. We have 12 that are listed on the guide, likely also contributed. We're also sharing a 2,000-mile border with Mexico, as we know very well, and cases are surging in Mexico, unfortunately. It's with the president, and it's a big problem for Mexico, but cases are surging very sharply and all across the rest of the Western Hemisphere. 257 miles of newly constructed wall along the southern border has had a great positive impact on people coming in, and we have record low numbers of people coming in illegally. That's helped greatly. It was really meant for a different purpose, but it worked out very well for what we're doing right now and for the pandemic. Nationwide, beyond the outbreak in several states, cases remain low and very stable. 19 states have positive test rates of less than 5%. 8 states have positive test rates of less than 2%. Our nationwide positive test rate is beginning to decline and is currently at 8.8%, compared to over 16% at its peak in April. It's coming down. It's coming down fairly rapidly. Today, we surpassed 50 million tests. That's far more than any country in the world. India is second, we believe. We think 1.4 billion people. It's about 12 million tests. We have 50 million tests. We're working with every state to ensure the supply of remdesivir for early case intervention and steroid treatment and various other treatments for those that are seriously ill. We're working very closely with hospitals, doctors, nursing homes, everybody. The remdesivir has proven to be terrific. Our case fatality rate continues to decline, and we want to push this rate even lower. The therapeutic research continues daily on new and very promising treatments, including antibody treatments and the use of blood thinners and steroids. A lot of different things are happening, and a lot of things are coming out that we wouldn't have known a number of months ago. We're doing tremendously well on therapeutic research and tremendously well on the vaccines. And frankly, therapeutically, or maybe a word even beyond that word, is cure, would be the best of all, and we'll see what happens. But that would be great if we could go into the hospital and just cure people. And we're at a position where we're actually able to a certain extent, with what we have right now, and we think that in a very short period of time we'll be able to do that. Our strategy is to shelter the highest risk Americans while allowing younger and healthier citizens to return to work or school while being careful and very vigilant. Wear a mask, socially distance, and repeatedly wash your hands. Practice very, very good sanitary means. You have to do this. You have to you have to look at it differently. Wash your hands often. I'm finding more and more people are saying wash your hands. So wash your hands. We want young Americans to avoid packed bars and other crowded indoor gatherings, and we're all in this together. And as Americans, we're going to get this complete. We're going to do it properly. We've been doing it properly. Sections of the country come up that we didn't anticipate, for instance, Florida, Texas, etc. But we're working with very talented people, very brilliant people, and it's all going to work out, and it is working out.